Welcome and a warm good evening to all of you. Thank you for joining us today for this insightful webinar on Neuro Electro Physiology. I'm your moderator, Preeta Harikrishnan, Deputy Manager of Admissions at Amrita Health Sciences, Kochi campus. We hope you find today's session informative and engaging. To ensure that we address all your queries, we have enabled the chat box. Please feel free to send your questions there and we will make sure to clear up any doubts during the question and answer at the end of the session. So to kick things off, let me introduce our esteemed speaker, Madam Sonu Ravindran. Madam Sonu is a Chief Neurotechnologist at Amrita Institute of Medical Sciences, AIMS, Kochi. She holds an MSc in Neuro Electro Physiology and brings with her over 14 years of experience as a neurotechnologist at AIMS. Additionally, she is an active member of the Indian Epilepsy Association and the Association of Neurodiagnostic Technology. I now invite Madam Sonu to share her valuable insights with all of us. Madam, welcome.
Thank you. Thank you for your wonderful introduction. Let's just start.
Yes, ma'am. You could share the screen.
Just 1 minute. How is the screen now? Hello, am I audible?
We are audible, but we are not able to see it, ma'am.
How is now?
Yes, we can.
Okay, shall I start?
Yes, ma'am.
Today's session is about Neuro Electro Physiology and career development. My name is Sonu Devendran from the Department of Neurology. In this session, I introduce the understanding of neurophysiology, importance of neurophysiology, Amrita Institute overview, faculty and expertise, students' activities and achievements, alumni success and global presence. What is neurophysiology? Neurophysiology is a specialized branch of physiology that focuses on the function of the nervous system, including the brain, spinal cord, and peripheral nerves. It explores the mechanism behind neural activity and communication integral for understanding behavior and bodily functions. This field examines how neurons transmit signals, how synapses are formed, and the biochemical pathway involved. Understanding this process is vital for developing treatments for neurological disorders and improving patient outcome. Neurophysiology, which plays a crucial role in medical research by providing insight into underlying mechanism of diseases such as epilepsy, stroke, and neurodegenerative disorders. This knowledge is essential for innovating effective therapies and interventions. Clinical practices. Clinical neurophysiology involves the diagnostic tests such as electroencephalography, evoked potentials, intraoperative monitoring, polysomnography, multiple sleep latency tests, somatosensory evoked potentials, nerve conduction studies, and these tests which aiding in the diagnosis of conditions like seizures, sleep disorders, and neuropathies. These practices are vital for accurate patient assessment and management. Neurophysiological research drives advancements in technology and therapies, innovative approaches such as brain-computer interfaces synthesis, clinical findings, and technical expertise, paving the way of novel treatment options.
Madam, could I just include? Madam, we could not see your screen moving. The slides.
It's not moving?
No, now you have changed the second. Yes, now it has come to the second one. Second or third.
Okay.
It was
Now
the
the topic is application of neurophysiology. The title is like that?
yes, now it is applications of neurophysiology.
Okay. Shall I move?
Yes,
Now
yes,
you
you
can
could.
see? Yeah. Okay.
Yes.
Okay.
Thank you, ma'am.
Okay. And then neurophysiology roles spans various domains, collaborating with the disciplines like neurology, neurosurgery, orthopedics, head and neck, psychology, and biomedical engineering. Such collaborations enhances research potential and foster comprehensive approaches to solving complex neurological issues. What is the importance of neurophysiology? This is by studying neurophysiology, professionals can develop targeted therapies for range of neurological disorders, improving the quality of life for affected individuals and addressing significant health challenges. Neurophysiology contributes directly to advancements in treatment methods such as characterizing neurological disorders and making significant role in patient care and recovery. Beyond the individual patient care, advancements in neurophysiology impact health, public health initiatives by addressing neurological disease prevalence and improving mental health outcome across populations.
Again, the slides are not moving, ma'am.
Oh,
Could you please?
what happened? How is now? Now I'm showing the main topics of NEP.
No, we can't see them.
Okay, now I stop the sharing and sharing and
Yes. I think you should,
yeah.
yeah.
Now
Yes.
the
No.
topic is main topics of NEP, na? Is it? Hello?
Screen share, you have to enable the screen sharing.
Yeah, it's enabling only. Now, how is the
Now we can see,
okay.
it, but it like as you keep moving,
Okay, now how is that moving?
slideshow, you could do the slideshow.
No, it's okay.
It should be slideshow.
In my screen, it is slideshow only, and share, in Zoom
Active.
also it's active. Yeah.
It hasn't been activated. That is what we see. Most of the features of PowerPoint has been disabled because it hasn't been activated. Activate. There is one showing activate. Do you see that, ma'am?
No, how is now?
Then go to slideshow.
In my screen, it is slideshow only.
It's slideshow.
Yeah.
Ma'am, I think then you like you click on each slide and then you could talk on that slide. I think it's better like that. Just try, ma'am. Like
Okay.
main topics of NEP. That is what is on the screen now.
Okay. The main topics of neural physiology are electroencephalography, which is the recording of electrical activity of the brain, then evoked potential, which is the test for the brain responses as a response to specific stimuli. Electromyography, which is a recording of electrical activity of the muscle. Nerve conduction study, which assesses the nerve and muscle functions. Intraoperative monitoring, which monitor the functional integrity of certain neural structures during surgery, which avoid the post-op deficits. Sleep study, which is performed to diagnose sleep disorders such as sleep apnea, narcolepsy, insomnia, and restless syndrome, etc. Video EEG monitoring, ambulatory EEG, electrocorticography, etc. are the other main topics. In our institute, we offer bachelor's degree and master's in neuro electrophysiology. If anyone interested to pursue PhD, we have the opportunity to pursue the PhD also. The curriculum of B.Sc, which includes anatomy, physiology, biochemistry, and computer application during the first year. In the second year, they have basic electroencephalography, physics and electronic, basic nerve condition studies. During the third year, the advanced electroencephalography, advanced nerve condition study, and electromyography, autonomic function study test, and sleep studies.
Is there a slide for that, ma'am?
Yeah. Now the slide is
we
okay. Then I will put like this only.
okay, one when you take up one and then show, I think that will be, because now what you said was not on the screen.
Okay. During the internship, the students will be prepared to handle various medical equipments that is related to the diagnosing of neurological disorders. The MSc curriculum, which include the electroencephalography and brain analysis, neuro electrophysiology, sleep and intraoperative neuromonitoring. During the second year, they have the advanced brain mapping and intraoperative monitoring studies. Their academic program, hands-on training, so that the students will be learning to handle the sophisticated equipment that is disorders. Sectional exams, journal clubs, guidelines, seminars, and clinical postings are offered. For the slow learners, we offer the extra classes and exams, tutorials, ICT-based teaching, demonstration of clinical skills, problem-solving exercises, one-on-one mentoring. Career opportunities. Careers in neurophysiology are diverse, ranging from clinical neurophysiologist to academic researcher and industry consultant. This breadth offers professionals various opportunities to specialize according to their interest. The demand for neurophysiology experts is steadily increasing due to an aging population and the rising prevalence of neurological disorders. This trend assures prospective students of robust job prospects upon graduation. Neurophysiology professionals often enjoy high earning potential, especially in clinical settings and research roles. The specialized knowledge and skills acquired lead to competitive salaries in various job markets. Amrita Institute overview. Sorry. Amrita holds a strong commitment to research, focusing an environment that encourages students and faculty to engage in cutting-edge studies, contributing to the advancement of the neurophysiology field. Our institute recognized for its commitment to education excellence and research innovation in neurophysiology, providing students with valuable knowledge and skills highly regarded in the job market. The institute offers comprehensive curriculum integrating theoretical knowledge with practical skills, preparing students for real-world challenges in neurophysiology and related fields. We have more than 25 years of experience. Our institute ranked among top 5 universities in India. Our structure and learning resources are 17 advanced video EEG machines, 3 ICU EEG monitoring machines, 3 NCV EMG machines, autonomic lab, sleep lab, intraoperative neuromonitoring machines, brain mapping lab, and electrical source imaging labs. Ahmedabad boasts state-of-the-art facilities, including advanced laboratories equipped with the latest technology, providing students hands-on experience critical for their professional development. The incorporation of advanced technology in both teaching and research enhances the learning experience, ensuring students are well versed in current practices and methodologies prevalent in the field. Extensive research labs and resources support the scholarly activities of the students and faculty, creating a robust environment for the experimentation and exploration in neurophysiology. Amrita Advanced Center for Epilepsy, which is the largest epilepsy monitoring unit in the country. High density EEG of with a 256 channel, which is the only clinical system in the country. Our center is the Advanced Center is the first in the country to develop stereo EEG program, which is using the robotic assisted stereo EEG. We reached more than 200 stereo EEG evaluations, which is the largest number in the country. Minimally invasive epilepsy surgery, radiofrequency ablation, that also a largest number in the country. Deep brain stimulation also we offer. Faculty and expertise. Dr. Anand Kumar, which is he specializes in clinical neurology. Currently, he is working in memory, autonomic function studies, dysarthria, lifestyle modifications, space mind medicine, and epilepsy prediction. Dr. CB research focuses on epilepsy and neurophysiology, contributing to the development of new therapeutic strategies and improving patient care. She treats patients with epilepsy and has expertise in management of patients with medically refractory epilepsy. Dr. Sudhiran Kanath, he is specialized in autoimmune neurology. He has developed the diagnostic criteria for intracranial infectious aneurysm. Dr. Vivek Nambiar, he specialized in vascular neurology and stroke. He has made significant contribution to mentoring students in research aimed at uncovering novel treatment and approaches and innovation strategies. Dr. Gopi Krishnan is a highly trained neurologist and specialist in neuromuscular disorder. He has expertise in areas such as myasthenia gravis, GBS, CADP, and autoimmune mediated neuropathies. Dr. Sharaf Udit he is a trained neurologist and movement disorder specialist. He has expertise in areas such as deep brain stimulation and EMG guided botulinum toxin injection. We have pediatric neurology experts also. Dr. Vinayan is a well-known pediatric neurologist. His specialties include comprehensive care of pediatric epilepsy, sophisticated neurophysiological diagnostics, and pre-surgical evaluation for complex epilepsies. Dr. Vaishak Anand, he specialized in neurometabolic disorders, dietary therapy in pediatric epilepsy, epileptic encephalopathies, neuromuscular disorders, pediatric demyelination, and neurocutaneous diseases. Collectively, these experts enhance pediatric care by integrating their knowledge into clinical practice research and education program, forecasting a comprehensive approach to childhood neurologic conditions. Other faculty members are Dr. Harilat and Dr. Annama Mathai and Ms. Akshaya Raman. Students' activities, arts and sports festivals. Our institute organizes various arts and sports festivals that promote student engagement and teamwork, allowing students to showcase their talents and build a well-rounded skill set outside the classroom. Students actively participate in national and international conferences, presenting research findings and networking with the professionals in the field, providing invaluable exposure and recognition to building neurophysiologists. These are the some photos of our students. They are awarded for the conference for the presenting their thesis and abstracts.
We don't see that, ma'am.
Oh. How is now? Is it
Yes.
visible?
Yes, yes.
Sports and cultural programs. Now it's visible now.
Yes, as you click on it, we are able to see it.
Okay. Then academic contributions. Students are encouraged to present their thesis and abstracts at prestigious gathering and in national and international levels. Research awards. Outstanding research efforts are recognized through various awards promoting excellence and encouraging students to pursue innovative projects within the realm neurophysiology. Graduates have achieved significant milestones in their careers, obtaining key positions in renowned institutions and organizations, showcasing the value of their education and training at Amrita. Alumni. Our alumni are Amrita alumni hold influential position in leading hospitals and research institutions across India, particularly in Kerala, Tamil Nadu, Karnataka, etc., contributing to the advancement of neurophysiology practices. Major urban centers like Bangalore, Mumbai, and Delhi serve as hubs for Amrita alumni who are involved in clinical practice, research, and academia, influencing both local and national health initiatives. Our alumni, not only in the national level, they are going abroad also. The UK offers vast opportunities for Amrita alumni with many finding positions for prominent hospitals and research centers throughout Scotland, London, and Manchester, enriching their professional journey. In the UAE, also, especially in Dubai, Abu Dhabi, Oman, etc., alumni leverage their expertise to excel in healthcare and research, benefiting from the region's robust investment in medical science and healthcare infrastructure. Amrita graduates are increasingly making their rank in international markets, with alumni successfully establishing careers in Canada, thereby enhancing the global footprint at the Amrita Institute's educational agency. The graduates and postgraduates are employed in the following clinical areas like neurophysiology diagnosis centers, electroencephalography labs, epilepsy monitoring unit, and nerve condition study labs, electromyography and single electromyography labs, multimode evoked potential study labs, in intraoperative neuromonitoring labs, sleep diagnosis centers, and magnetoencephalography labs and neuroscience research centers. After the completion of the course, they are posted in different states and national and international levels in different hospitals. Salaries varies from recruiters to recruiters. Some pay high salary packages depending upon the locations. The salary increases exponentially according to the skills and experience gained in their careers. Thank you. Learning from India is top from the top ranked university. Thank you very much.
Thank you, ma'am. But a request from my side, ma'am, could you just show us some of the main slides, like from the beginning, once again, so that because in between there was
Interruptions. Okay.
yes. So some of the main slides, which you feel you should show them. Yes.
Courses.
Okay.
Bachelor courses and master's courses also.
And your video is also not on, ma'am. Could we see you?
Okay.
Thank you, ma'am. Thank you. Yes. Next slide, ma'am.
This is the curriculum for bachelor's course.
Okay.
This is the curriculum for the master's Neuro Electro Physiology.
Okay.
Our infrastructures. High advanced labs.
Okay.
These photos from our lab only.
So these are the credits that we have, is it, ma'am, from the slide that you're showing?
Yeah. Our faculty members.
Okay, ma'am.
In different specialties, stroke, neurology, neuromuscular disorders, movement disorders, epilepsy, and memory clinic, and pediatric neurology also.
Okay.
And these are the main slides.
Okay. So you could stop screen sharing, ma'am, now.
Okay.
So I think after seeing the slides, they would be much more happier because though there were interruptions in between, I'm so happy that you could show us those slides. Ma'am, a few questions I have just to ask you to make it more simplifying it for them. Like, are students exposed to any real life cases or live demonstrations while they are using the techniques in neurophysiology?
Yes, they have hands-on experience from here. During the first year, they have theoretical classes only. From the second year and third year, they have internship also is there. So they have hands-on training also is there.
Okay. So this hands-on training, like which year it starts? Is it from the first year or
No,
first?
not from the first year. From the second year, it start.
Okay. So you were telling about the career opportunities also, like for our, especially our students who join Amrita for neuro electrophysiology. How many of them are being placed?
Most of the students are placed. Only few members are not posted because of their family issues only. Otherwise, all are posted.
Okay, they get into jobs of the same program that they're studying.
Temporary. Yeah, yes.
Okay, ma'am.
In the
And okay, ma'am. And the teaching methods that you're using in the program, is it clinical,
teaching.
clinical lab
Yeah,
simulations? Or,
clinical lab also is providing, and also the seminars and lectures also are providing. And then they have the thesis also in the B.Sc and master's level also. They
no, the
have to submit the thesis
thesis
also.
even during the bachelor's.
Yeah, even during the bachelor's also they have to submit.
Okay.
So
Madam,
they.
oh, okay, madam. One more question. Like when these NEP students, they come to join this course, what have they to be ready with when they're coming to join this course? What they have to be ready with when they come here?
Yes. What do you mean that by
Like
that?
mentally, how have they to plan out? Like now they
Okay.
have come to join. So maybe you could, like the beginners, they being the
Mm.
beginners,
Mm.
what should they be like? What is their attitude? What should be the attitude towards this particular program as they come? Because plus two is
Especially
so
the
much
allied
different.
health. Yeah, yes, yes. After the plus two, everyone is going to degree or in degree in some specialties. But here is the allied health professional. So allied health professionals means we are directly interact with the patients. So we have to mentally prepare like that only. Okay.
So it is more of patients that they will be
Yeah,
facing.
patient care. We are facing the patient care also. No? So we
Okay.
have
So
to
it
prepare
comes
like
from all,
that.
it comes in all ages, ma'am.
Yeah, from neonates to elder age.
Okay. So any gadgets or any kind of machines that they have to be operating?
Yeah, yes. Most of the our machines are for diagnosing the neurological disorders. Na? So we had to operate we had to operate those machines.
Okay.
We had to
So
handle all
ma'am,
those parts.
okay. So thank you so much, ma'am, for your valuable insights. Like, ma'am, in between, if they have any doubts, we could just take up those doubts. Meanwhile, before we wind up the webinar, we have Sanuja who will be detailing us about the admission process. Sanuja, welcome.
Yes, madam. Thank you. Good evening, all. I am Sanuja from Admission Office, Kochi campus. Today, I will give you the basic ideas of the admission procedure of neuro electrophysiology. And Amrita offers 18 allied health sciences program, and neuro electrophysiology is one among them. And the duration of the course is 3 years plus 1 year internship. And coming to the eligibility, the candidate should be of minimum 17 years of age and maximum 23 years as on December 31st of each academic year. And pass in plus two with 60% aggregate marks in physics, chemistry, and biology. For all specialities, selection for the candidates will be based on the rank obtained in the Amrita entrance examination, life science, and an online interview. Then coming to the entrance examination, exam will be computerized online exam to be taken at respective examination centers allotted to the candidates. And the syllabus is based on +1, +2 physics, chemistry, and biology. And now the link is open for registration, and the students, those who have interested in studying Amrita, can apply now. And the link for registration is applyug.amrita.edu. And the website link is amrita.edu/admissions. Then coming to the Amrita entrance examination details, the duration of the entrance exam is 2 hours and the number of questions is 80 and 25 questions each from physics, chemistry, biology, and 5 questions from English. And total number of questions is 80 and total number of marks is 240. And for every correct answer, the students will get 3 marks and for -1 will be deducted for every incorrect answer. Then coming to the fee structure for Neuro Electro Physiology 2025, we have 3 categories. That is, first one is scholarship category, second one non-scholarship category, and NRI categories. And the fee structure for scholarship category is rupees 1,80,000, and for non-scholarship category rupees 2,60,000 per year. And for NRI category, you should pay in dollars, that is for 4,500 USD. For first year, the students should pay 2,500 rupees for admission processing charges. And the other fees will be 39,600 and the hostel mess fees will be 80,000 per year. And the hostel is not compulsory for those who have residing in within 20 kilometers. And coming to the steps for registration, we have 6 steps for registration. The first one is register with your email ID and password. Then the second one, personal information. You have to fill your personal details like name, birth, date of birth, email ID, and all. Then third step is application. You have to fill your application preferences. And then fourth step is payment. You have to make a payment of rupees 550 rupees and you have to select 5 methods of payments. You have to select your interest. Okay. Then fifth step is academic details. So you have to fill your academic details, 10th marks, the last you studied, the schools and all. Then the sixth step is documents uploads. Whichever documents you have, you can upload it. Then coming to the inquiry, any inquiry relating the admission process, the candidate can please feel free to call us and or mail it to UG admissions. And the mail ID is ugadmissions@aims.amrita.edu, or you can call us and the numbers are given below and all the details are clearly mentioned in our website. And please note that Amrita Vishwa has not appointed any third-party clients or agents to secure admissions. And last and final, thank you for all. And if any doubts or inquiries regarding the admission process, you can call us and mail to us. Thank you all. Have a nice day.
Thank you, Sanuja. We could get information on the admission process. And let me just tell you that we will be having the entrance exam it'll be somewhere in the 3rd week of May. So you should be prepared with your +2 physics, chemistry, biology, and a little bit of English. And we expect that you all join us here in the Amrita campus over here at Kochi or at Faridabad. And before we wind up, I would want to know if there are anyone there in the attendees who have any more doubts. We could allow you to speak up and we could clear your doubts. I think there was Safa. Is Safa still there? Safa, you want to ask some question? Any doubts? Yes, Angel Mary Joseph. You could unmute.
Hello,
Yes.
can you hear me?
Yes, of course.
Yeah, ma'am, we are already registered for the Institute of for the NEP and also for the CVT also. So both together only one application is required or two required?
One application. You have
One
already
application.
given your preference, isn't it?
Yeah, already preference. Then
Yes.
I want to apply for two more B.Sc nutrition and food science and nutrition also. We can again we want to.
You could edit and you could do it.
Okay, okay, ma'am.
It's a
Thank you.
common entrance exam.
Okay, okay.
Thank you. Anamika Sajeev, you could unmute.
Can you hear me?
Of course.
Ma'am, do we have B.Sc Nuclear Medicine Technology?
Yeah, we are starting that this year.
Okay.
You
Thank
could register. Anyone else? Anyone else with any doubts?
Yeah.
So I think then we could wind up as we are almost done with what neuroelectrophysiology is. And we have also got to know the process of the whole admission this year. And I thank each one of you there, especially Sonu ma'am, who between her precious time of her work has joined us today, this evening. And my heartfelt gratitude to you, Madam Sonu, and also to each one of you, all the attendees who have joined us here today. And I hope this session has sparked your interest in Amrita and the neuroelectrophysiology program. So once again, I thank you all. Wish you all the best in all your future endeavors. Take care and hope to see you soon in the Amrita campus. Thank you all.